Hello and good morning. My name is Susan Morris. I'm a clinical nurse educator at the New Brunswick Heart Center. And today I am doing video number 3 entitled Use of the Blanketrol III for Targeted Temperature Management. So post-cardiac arrest, we cool patients to preserve neurological function. And video 1 and 2 talked about the evidence behind and how the Blanketrol works. This is just an overview of how the blanket will work. So let me allow you to see my screen, and I will share with you a PowerPoint presentation about the blanket itself. So the blanket is manufactured by Cincinnati Sub-Zero. And so the Blanketrol III has a few upgrades from Blanketrol 1 and 2, and I'll go into those. So there are hoses that connect the unit to a blanket or a cool kit, and water is allowed to circulate between the two. I'll show you what a cool kit is later on in this discussion. In order for the machine to work to its full potential, you need a temperature probe attached to your patient, and that will depend on what your hospital has decided for a temperature assessment. Rectal is the least reliable. You could have an esophageal probe, which we use occasionally. We do like to use the probe that is connected to our Foley catheter. So we have special order Foley catheters that will sense the patient's temperature. And then if you had a patient with pulmonary artery catheter, that is probably the most sensitive core temperature. So there is an area that the patient will be connected to the machine. So when you set a patient's temperature, let's say you want to maintain normal thermia, you would type into the machine 37 degrees. The blanket would function by warming or cooling depending on what the patient's temperature actually is. So if we set the machine to 37, but the patient's temperature is 36, then the machine would warm the patient. If we set the temperature that we wanted our patient to be at 37, and the patient was actually 38 degrees, then the machine would cool the patient and bring them down. So it can warm or cool as requested. When we begin to use the blanket, we also put distilled water into the back of the machine, and I'll show you that at a later date. So heat or cool is transferred through the blanket that we use. And so I encourage you, if you have the ability on your machine, to use 2 blankets at one time. And this Blanketrol III actually has 3 connections, so you can use 3 sources of transfer. So a blanket below the patient and a blanket above the patient are really what's recommended, and will bring you to target temperature the most effective way, or the quickest way. So water circulating through the blanket, when the temperature of the water is cooler than the patient, will obviously cool the patient. The opposite is true when the water is warmer than the patient. It will warm the patient. So the difference between the patient's temperature, and the greater difference between the patient's temperature and the temperature of the machine, will cool the patient or warm the patient quicker. So the bigger difference is the fastest means of cooling or warming. And there are a number of modes that you can use to do this. So modes of operation, I'll just go over briefly. So the first one is the monitor-only mode. And this really is not a therapy at all. It's just a way for you as the clinician to continuously measure the patient's temperature. And It does not allow the blanket to come on or off automatically. It is simply a monitoring for temperature only. The manual mode. So in this mode, there's no probe put into the patient. And so the only thing that we can dial into the machine is to tell the machine how warm or how cold we would want the water temperature to be. This is not a mode that we use very often. Actually, we don't use this mode at all. We would prefer that the patient always has some way of having their temperature monitored so that the machine can function at its peak and be able to turn the water temperature up or down to achieve what we are looking for. So in the manual mode, the operator has no control over what this temperature will do to the patient. So it's not a mode that we use very often. Automatic mode is one that we use frequently, and this is the fastest way to get to target temperature. So the auto mode will allow you to cool or warm the patient as quickly as possible. But the reason why we don't maintain or leave the patient in automatic mode is because there is fear of overshoot, because it is very effective in getting that patient to target temperature. We use it to initiate. So within 4 hours, we like to have our patient at target temperature. So our target temperature at the New Brunswick Heart Center for cooling post-cardiac arrest is between 32 and 34 degrees. So what we do is we set the temperature for the patient to be at 34. And when we do that, the machine will kick in and cool that patient, but it knows what the patient's own temperature is because we have it plugged into the side, and it can sense this feedback, and it can increase or decrease the temperature of the water. So this is for induction, or if you needed to warm somebody very quickly, maybe they were found outside and they were hypothermic, you wanted to rewarm them quickly. Just be careful with rewarming patients quickly. There are some hemodynamic consequences to that. And if your patient does have any cerebral damage, this may worsen that cerebral damage. So make sure when your physician is ordering the therapy that you understand the consequences of warming too quickly. So when the patient's temperature reaches the set point, so what we have said, the system continues cycling the water through the system, but it stops heating and cooling. So once it's reached, the machine just continues to monitor. And if the patient's temperature deviates 0.2 degrees from the set point, then the system will either start warming or cooling depending on the need. The automatic mode of the Blanketrol III can really create a rapid drop or a rapid rise in temperature. So overshoot is what we are fearful of, and that's why we use it for the induction phase only. So once we have achieved target temperature, then we will move to a gradient mode. And so there are 2 gradient modes that we can use. But the reason why we switch to the gradient mode is it allows the caregiver much more control over the water temperature so that there is not a huge swing in the patient's temperature. So it minimizes overshoot. So gradient modes, a larger number allows the water temperature to adjust more aggressively. And that more aggressive is what we saw in the automatic mode. If we were to use a mode called gradient 10, then our target temperature will be a maximum of 10 degrees warmer or 10 degrees cooler than our patient. But please keep in mind that our machine will only go to a max of 42, which is very warm, and to a minimum of 4 degrees. So the gradient modes allow for less overshoot, and they are good for the maintenance and the rewarming phases. So the gradient 10 smart mode is what I encourage people to use initially. Once you have reached target temperature, you are now going to press the temp set button, and you are going to push the gradient 10 Celsius button, and the water will start to circulate. There is also a gradient variable button. And so maybe you are finding that the gradient 10 is not achieving the temperature that you want it, because in the gradient 10, the water will never be 10 degrees, more than 10 degrees warmer or cooler than the patient. And so maybe that isn't a big enough gradient. So you can go in and hit gradient variable, and you can dial in the number that you want. So for example, the patient's temperature is 35 degrees, and you dial in a variable of 20. The coldest the water will get is 15 degrees Celsius, because we subtract the 20 from the 35. And so the coldest the water will get is 15 degrees. Whereas if we had the patient in the gradient 10 variable, then the coolest the patient's water, or the water in the machine, would get is 25. So this just allows you a little bit more autonomy with the machine to allow you to reach target temperature or maintain target temperature. So a lot of my colleagues in the southern US will use gradient variable in the really humid summer months, because you may notice some condensation or pooling on the blanket itself. I've never actually encountered that, maybe because I live in the Maritimes and warm temperatures are usually not an issue. But setting the gradient variable to a little bit higher than 10 degrees will allow that less condensation to happen. So to do that, all you do is hit the gradient variable button. The screen will light up, and then you press up or down to the arrows to get the achieved number that you're looking for. I would suggest that if you are using a gradient 10 and you're not able to achieve that, I would go to gradient variable and try 15 degrees. And if 15 didn't work, then I would try 20. So I wouldn't go directly to 20 right away, because again, the greater the difference in the water temperature in the patient, the greater chance there is for overshoot. So I would try 15 and then go towards 20. The smart mode. Smart mode is new to Blanketrol III, and it is something that I will always use when I am in a gradient, whether it's gradient 10 or gradient variable mode. So the smart mode can be used with the gradient modes, not with the automatic, but with the gradient modes. And so basically what it does is every 30 minutes it says, what is my patient's temperature? And at that 30-minute mark, it says, we have not achieved targeted temperature. And the machine will automatically add 5 degrees Celsius to the water or take away and make this temperature 5 degrees cooler, depending on what the patient's temperature is. So it takes a look every 30 minutes and it will either add or take away 5 degrees to achieve target temperature. Again, remember that the hard stops are 4 degrees Celsius, so that's the lowest it will go, and the highest it will go is 42. So I think the smart mode is a really good thing to use. It's helpful, it minimizes fever, it minimizes the shivering associated with fever, and it helps you manage the really muscular patients a little bit better, because oftentimes they are more difficult to achieve targeted temperature. The smart mode is best used when we use the gradient variable of 20 or less. So a little more narrow difference between the patient and the temperature. And it is very helpful in the gradient 10. So once you've selected your gradient mode, you simply push the smart button, a green LED light will come on, and that just gives the care provider a little bit extra control over the temperature. So points to remember is that a therapy always requires a medical order. Skin should be closely monitored. We recommend every 20 to 30 minutes. But check with your hospital policy. If you are using the non-disposable blanket, then you will need to put a thin white, just plain cotton, not the flannel, but the cotton sheet between the patient and the blanket. If you are using the Maxi Thermalite, then these are disposable, single use. And you do not need to put a skin barrier between the patient. They're made of a very nice thermal conducting material that is comfortable for the patient to lay on, but also minimizes the potential for frostbite. But still, pay special attention to your patient's skin. So here is a picture of a cool kit. A cool kit has a head or helmet, a vest, and then a blanket that comes across the lower extremities or lower trunk. If you notice here, and I'm not sure if my pointer is in the right spot, but you will see that there are actually 3 areas that exit out of the blanket. And each of these sources of cooling are connected to a separate hose. So the helmet has its own water supply, the vest has its water supply, and the small blanket that goes over the lower trunk has its water supply. If you were caring for an infant or a neonate, they have cool kits that include a blanket. And the recommendation is that the blanket go underneath the infant or neonate. There are mittens, booties, there's a little helmet, and they also have esophageal and rectal probes for infants. The mittens and the booties allow for family contact, and so it doesn't interrupt any bonding or anything like that. These are all isolated, self-sealing, and so there shouldn't be any worry about grounding. My colleagues worried about, well, can I defibrillate with my patient connected to the blanket? Yes, you can, but if they had a vest, you would have to open this vest, get it out of the way, and apply your defibrillation or pacing pads that way. These are the MaxiTherm light blankets. This one here could be used for a patient who's incontinent frequently. They're a little more durable, but of course they're a little more expensive. They are single use. These are the ones that we use most often at the New Brunswick Heart Center. They have a nice feel to them. They're soft against the patient's skin, and they are single use. So we put one blanket beneath, one blanket on top, and it works very well. These are the plastic pad. They are the reusable. They need to be washed through between two patients. So find out what your infection control department would prefer, and ensure that these do get cleaned before and after each patient use. You can also buy just plain vests that maybe a surgeon or a technician would use in the OR. But you can also just buy the head helmet, because we know that we lose a lot of heat from our head. So if you needed to warm somebody, then this helmet may work very well, but also cooling, it can be used too. Some additional products that may be of interest to you. These are the black tubings that we use for our disposable blankets, and we just keep them connected to the patient. So you can get the 9-foot, 18, and 27-foot. These are reusable. Encourage your staff to clean them between patients and not to discard them. This is a roller stand that you could put some of your blankets or whatever in that is available through the company. And then these are gel rolls. So if you've ever been in an operating room, you'll see that a lot of times they have gel rolls underneath extremities. These gel rolls are, again, very protective in nature for skin, but can also be used to warm and cool. So they have the adapters here that friction fit onto the Blanketrol, and you'll see that they actually click in place, and then you'd be able to circulate the water through the jelly roll and cool or warm the patient that way. Additionally, there is an area on the left side of the device that would allow you to connect this cable and connect it to a laptop, and you could download temperatures, or you could download data from the patient. And basically what you get is patient temperature if you have the probe connected to the patient, and you have water temperature. It would allow you to examine how fast patients got cooled, what was the best temperature, and it may help you with protocol development, but it may just be of interest to share with your staff to say, X amount of patients got cooled within so many hours. It took this many hours to rewarm. So it's just a data retrieval software kit. And that brings us to the end of our review of the Blanketrol. The next video will be about how to actually use this machine. So thank you for your time and have a great day. Thank you.